Hi everyone, I'm Dr. Kelly, and today I'm gonna talk about how to prevent getting toenail fungus and athlete's foot. This is an important topic. Sandal season is upon us, and we all want to show off our toes or go barefoot on the beach. So I am going to talk about these two conditions and discuss how you can prevent getting these infections. So we're going to start with athlete's foot. Athlete's foot is basically fungal infection of the skin on the bottom of the feet. You don't have to be an athlete to get an athlete's foot. So anybody can get athlete's foot, and perhaps a lot of us have it but doesn't recognize it as an infection. A lot of patients come to me and they don't even know that they have athlete's foot, and when I point to their skin, they say, oh, this is just a dry skin. But in fact, it is a fungal infection. So there are a few things that you need to be aware of so you don't get that. One is exposure, meaning that you could get athlete's foot from your own environment. This could be from a public place like locker rooms in a gym, or a shower floor, a public shower floor, hotel room, hotel shower. It could be public swimming pools. So that would be one place that you need to be careful. So make sure that you wear a shower shoe or flip-flops. Another place that you can get exposed to athlete's foot is nail salons. Nail salons are, you got to make sure that where you go to, they're fairly clean. If they're using a chair that has a jet, you have to make sure that the filter in the jet is being cleaned properly, because previous person could potentially have fungus, and then through that water churning and that jet, you could be exposed to their fungus and bacteria. And another exposure area would be your own shower floor. So if you have family members that they have fungus and you guys are all sharing the same shower, you could potentially be exposed to that person's fungal infection. So that's as far as the athlete's foot. The toenail fungus is a little bit different. You can get toenail fungus from not necessarily trauma, but the trauma to your nail can set you up for toenail fungus. For example, people come in and they say, well, I dropped a can of food on my toes, and when the new nail started to, I lost the toenail. When the new nail started to grow, I started noticing that there was some discoloration or thickening. So it's possible that the person was exposed through the previous situations that I mentioned, meaning that maybe their nail was injured, and then they were exposed to fungus in a public shower, or they were exposed to fungus in a nail salon through dirty instruments, or that tub with a filter, or it's possible that they shared maybe clippers with family members, and that's how they got toenail fungus. You could also get toenail fungus from athlete's foot. So if you have had a chronic athlete's foot that has been untreated, that can eventually go to toenail and infect the toenail and the nail bed. Vice versa could happen. Someone could have toenail fungus for years, and then that fungus eventually will spill into the skin and infects the skin, the surrounding skin. The skin surrounding the toenails can start to look peely and itchy, and that could lead to entire athlete's foot on the bottom of the foot. So there are certain things you need to do to kind of counter all these issues. One is again, make sure that you wear shower shoe, or you wear flip-flops in again, public area, and that should give you some protection. Make sure that the nail salon that you're going to, they're using They're not using a jet for soaking your feet. It's just a basin with a liner that can be thrown out, and so you're not exposed to the previous person's previous clients' germs. Their instruments need to be cleaned properly using autoclave. Sometimes UV light machine that they use is not enough, and so autoclave is really a gold standard to clean instruments. Their files need to be also cleaned properly. If these files or pumice stones cannot be autoclaved, then they need to use a new one on each client. Also make sure that the products that they use on you, they're not contaminated. For example, a nail polish that has been used on a client and that client has fungus, that brush is contaminated. And if you are the person who goes and uses the same polish, or your nails are being polished by the same brush, you could potentially have the fungus transferred from previous client to you. And that goes for both base coat and top coat. As far as home situation, make sure that your shower floor is either bleached or you use distilled vinegar periodically to clean your shower floor. If family members have it, you definitely want to protect yourself. If you have it, you want to protect your family members from getting fungus. And also, if you are in the middle of a treatment, you definitely want to make sure that that you're not recontaminating your own skin with your own fungal infections. So cleaning the shower floor is as easy as just getting a spray bottle, putting a little bit of bleach or vinegar, add a lot of water, have it by your shower floor, and just bleach your shower floor with a couple of sprays. Make sure that your nail clippers are also bleached properly, or you use distilled vinegar to clean them. You can wash it with soap and water and then bleach or use distilled vinegar. That's also okay. And don't use other people's clippers. Everybody should have their own clippers in a household. You certainly don't want to share anybody else's. Just like you wouldn't share toothbrushes or brushes. And also make sure that you are not using the same clipper that you use on your toenails, on your fingernails, because it's very easy to transfer that fungus to fingernails. Also, if you are dealing with fungus yourself, and you are in the middle of treatment, make sure you wash your socks with either bleach or vinegar, depends on the color, or you spray your shoes with antifungal spray, because you don't want to recontaminate your own skin again. So again, make sure that all of these are done properly, because treating a fungus is not. It's difficult to treat fungus, especially toenail fungus, and really the best way to treat it is not to get it in the first place. So I hope that you find this information useful, and thank you for watching. Until next time.